Hope your work week is off to a good start. You're watching 아리랑TV's Monday edition of COVID-19. I'm Incheon International. Starting from this week, we have what we're calling the K-series that seek to look into the different arenas that Korea has touched upon amid the global pandemic with its efforts to bring it under control. Today, we'll be focusing on K-quarantine in the latter half of the program. But first, as always, here are the headlines with our Kwon Soa and Noaram. Welcome.
Hi.
So let's start on the domestic front. What are the numbers you have for us today?
Well, first off, the weather is getting warmer and many people are still on their extended golden holiday. But COVID-19 is still with us and new cases are still being reported every day. But the numbers are stable and local infections have declined significantly as well. Now, taking a look at our figures, we have 8 new cases as of midnight and all of them are reported as imported cases. 2 additional fatalities brought the death toll to 252 and over 9,200 people have completely recovered. Now, in the past 7 days, we can see an up and down between daily cases in their teens and single digits. On April 28th, we had 14 cases and on Sunday 13, but now we're back to 8 this Monday. Now, as the coronavirus is relatively under control now, the government is preparing to improve the country's healthcare system to deal with the pandemic in the long term, with risks of a second major outbreak always lurking. Other salient issues include the reopening of schools and how to manage short-term foreign laborers amid the pandemic, as well as people entering the country from overseas. Vice Health Minister Kim Gang-nip meanwhile said at an earlier briefing that in the past 2 weeks, the source of infection for around 10 patients remain unidentified and more contact and movement is occurring during the golden holiday, calling for caution, especially on Children's Day, which is tomorrow. And authorities also stressed that mature civic consciousness needs to continue in order to shift to the so-called day-to-day quarantine measures. And I think Aram is going to explain that later on.
Yes, he is. Meanwhile, so elsewhere around the world, people in the U.S., I understand, have been streaming to crowded places over the weekend.
Right. I mean, we've been seeing fuller parks here in South Korea as well, but it was a different situation compared to Korea, where most people are still wearing masks in public locations. It is looking different in the U.S. A lot of people who were spending time at bustling parks and beaches did not seem too worried about the ongoing pandemic seen in the absence of masks, despite being physically close to each other, as we can see here. So while numbers are slowing down, depending on where you are, such as the epicenter of the virus in the U.S., New York, as more and more people are not following social distancing rules, New York Governor Andrew Cuomo had some strong words to citizens over the weekend, calling for more respect and responsibility. He said it's disrespectful to the frontline workers to not wear masks, adding, quote, "You wear the mask not for yourself, you wear the mask for me."
I see. Meanwhile, in Japan, a state of emergency is expected to be extended.
Right, that was initially going to end this Wednesday, but it looks like this emergency state is going to be extended until May 31st. Prime Minister Shinzo Abe is expected to make an announcement Monday evening, but the decision appears to have been already made at the Prime Minister's office on Sunday, as top officials have hinted the emergency state, which calls for people to stay at home if possible, and has also led to the shutdown of certain businesses, will be extended. The move comes with Japan's total number of COVID-19 cases approaching 15,000, and hundreds of new infections are being reported on a daily basis amid growing concerns over lack of hospitals. Depending on region, a slowdown is seen too, with plans to allow public facilities like parks, museums, and libraries to resume operations soon, despite the predicted extension of an emergency state. Now, across the world, we have a total of over 3.5 million cases now, affecting 212 countries and territories. We can see on the map which places are affected most, like the U.S., the only location with more than 1 million cases. In Europe, we see many with more than 100,000, also in South America's Brazil. So let's take a closer look at places hardest hit by the virus. We have a death toll of over 68,000 now in the US and far over 200,000 accumulated cases in Spain and Italy, with more than 28,000 deaths in Italy and the UK, and a high mortality rate in France with almost 25,000 deaths, despite having a similar total number of cases as Germany. And Russia has developed faster rises in cases than the regions that I just mentioned before.
All right, so thank you for that. But do stay with us for the wrap-up of the afternoon briefing.
All right.
Right, Aram, the government's emergency disaster relief funds are going out today. What more can you tell us?
Well, just under 3 million households in the low income bracket, so that will be people on basic pension or just disability benefits, have been getting cash deposits from today, in fact. So it has started coming out today, and the timing of the payment can differ depending on circumstances of local governments, but all the cash remittances will be completed by Friday. For the rest, online applications for the funds will begin on the 11th, so that's next Monday, and they will either get a gift voucher or electronic cash that can be used at designated stores. And just a word of warning, these gift vouchers do have an expiry date on them. 3 months is said to be the period that you should be using them, so do take that in mind. In terms of the amount of money being received, 4-person households will get 1 million won, and it will go down 200,000 won depending on the amount of people in the household. So 800,000 for 3-people households and individuals. So single-person households will go down to 400,000 won. Offline applications for card points, gift certificates and prepaid cards will begin at banks affiliated with card companies or community centres nationwide on May 18th. Now, the amount and timing of payments can vary, so citizens can check details on a government website that was launched separately today, actually, to outline the household's eligibility for the funds. The top 30% income earners will be able to donate the funds back and get tax benefits in return. And also, if they don't apply for the funds at all, then it will be considered a donation. And to keep people from applying all at once and from to prevent servers being overloaded, the government will run a 5-day rotation system according to the last digit of one's year of birth, just like we've seen with the mask rationing system.
Oh, I see. Meanwhile, the social distancing campaign is looking to transition into a daily life quarantine initiative.
That's right. The government will allow people to engage in a certain level of economic and social activities while maintaining disinfection measures, of course, during their everyday life. Now, these new social distancing guidelines announced by the government advise people to stay at home for 3 to 4 days if they feel unwell. They also are urging people to keep a safe distance of at least 1 metre with others in public spaces, as well as wash hands frequently, of course. Now, public facilities such as parks and libraries will open their doors, and schools could also actually reopen in phases. Now, facilities that do open are also being advised to designate a manager tasked with overseeing quarantine activities and virus prevention measures, and they will be in close contact with health authorities as well. Meanwhile, sports matches such as Korea's top baseball league is also set to start this week, as well as a few football matches as well, albeit behind closed doors, so there won't be any spectators. And the new guidelines aren't legally binding. They are strong recommendations by the government, but the government is considering imposing some penalties if there are violations of some core instructions, especially related to disinfection.
I see. More grim figures coming out regarding the global economy.
That's right. Let's zoom in on the world's travel and tourism sector, which has been very hardly hit by the pandemic. A staggering 100 million jobs in that industry are now at risk due to the pandemic. Now, that figure, based on research by the World Travel and Tourism Council, or the WTTC, has increased 30% in the last 4 weeks, in fact, indicating the sheer scale of the crisis affecting tourism. To be exact, it's 100.8 million jobs at risk, and almost 75 million of them are in G20 nations. And the WTTC has alerted G20 tourism ministers to the extent of the crisis during a virtual conference last week. The punishing impact of the pandemic has led to over 1 million jobs already being lost every day. And the WTTC analysis also shows a sharp escalation in losses to the world economy, up to 2.7 trillion US dollars of GDP, up from the 2.1 trillion just a month ago. Now, the WTTC's CEO said travel and tourism is the backbone of the global economy and urged governments to swiftly support and protect the sector. In 2019, travel and tourism contributed more than 10% to global GDP, a staggering amount, and was responsible for generating 1 in 4 of the world's new jobs. So it has taken quite a hit.
I see. All right, Aram, thank you for that. We'll see you on Wednesday. Now, it's a little after 2 o'clock here in Seoul, and we're waiting to join the Central Disaster and Safety Countermeasure Headquarters for its regular briefing on the COVID-19 situation in this part of the world. As mentioned earlier, the most recent cases of COVID-19 here in Korea are imported infections, and accordingly, health authorities are poised to transition their social distancing campaign into a daily live quarantine initiative from Wednesday that will see the resumption of schools and certain businesses, albeit in a gradual manner. Local cases of the virus have been hovering in the teens, single digits, and on some days like today, no such contagion has been found. Meanwhile, as of Monday, Korea's total infections stand at 10,801, and from this figure, 9,217 have recovered. Korea's death toll stands at 252, which has been raised by 2 losses of lives as of early Monday. Korea's right, and like our Kwon-soa said, there have been 8 new cases today, raising our total to 10,801. From these 8 cases, all are imported cases. Officials here have apparently tested more than 633,000 people for a virus since early January. We are still waiting for the regular briefing, the afternoon briefing by the Central Disaster and Safety Countermeasure Headquarters. And perhaps while we wait, we could turn to our Kwon-soa to give us yet another, some more information, that is, on the global figures of the virus.
Yes, let's take a look at our map here again, which indicates how many cases have been accumulated across the world. So those places that are dark red, the darkest red color stands for the cases above 1 million. And we know that's only happened in the US. The US has now more, I think a quarter or even a third of the cases in the US account for the total number of cases across the world. And there are a lot of places here at a lighter dark red, over 100,000 cases in many places in Europe, and Russia also has more than 130,000 cases. So let's take a look at the major outbreaks across the world. Here we see them again. We have more than 68,000 deaths in the US alone, and Spain, Italy, the UK, France all have more than 20,000 deaths. Although we are seeing a slowdown in these countries, which is why many European countries are now getting back to the economy, reopening some of their businesses as well. And if we take a look at Germany and Russia, Brazil, they all have cases far exceeding 100,000. Recently, Brazil's case has also surpassed 100,000, the 100,000 mark, that is, with more than 7,000 deaths. And Iran also getting close to 100,000 with 97,424 cases and more than 6,000 deaths. And far at the bottom, we're seeing China with 82,880 cases.
What about the situation here in Korea again, Soa?
Well, let's take another look at our table then for the domestic numbers, if they will pop up on the screen soon. We do have 8 new cases here in the country, which brings the total number to 10,801. I think we're going to take a look at our graph now. Here we see 7 days, the past 7 days, we started with 14 cases on April 28th, and then we do see a decline to 9 and even 4. That was quite significant, and we got back to 9 and 6. And yesterday we did see double digits, but again, we're back to 8. So it looks like we are going up and down between the teens and single digits. So the numbers are looking quite stable, and this is why we are also getting prepared to going back to everyday quarantine measures, which Adam explained earlier. And maybe we could talk a bit about those measures while we're waiting for the briefing.
Yes, of course, actually, we could go and yes, Adam, tell us a bit about the emergency emergency relief funds that are going out starting from today again.
Yeah, so just to remind people, the emergency relief funds, the first cash deposits that are going out from today will be for the 2.7 or 2.8 million low-income households, so those people on basic pensions and disability benefits. They'll be getting cash deposits in their bank accounts. They won't have to apply because the government has already collected their bank details already, so they will automatically get the funds in. And the timing, of course, and the amount does differ according to household and person, so those details will be available on a government website. And for the rest of the people, the applications will start next Monday, so on the 11th, and they will get either a gift voucher or electronic cash, and that can be used at designated stores within a 3-month time period.
Right. Now, it appears that the regular afternoon briefing has been delayed for a bit. So while we wait, we'll give you another story. The wearing of face masks here in Korea has been the norm for quite a while, but it remains foreign in quite a few places, that is, around the world. In this next video, we meet a Korean designer in the UK who is distributing handmade masks as part of efforts to raise awareness, that is, about their importance in quarantine efforts.
Hello, this is Jackie Lee from JJS Lee. I'm living in London for last 15 years already here. I'm actually doing the mask donation at the moment. I started first week of March when the outbreak happens in London. That time no one really wear the masks on the street, even though I was thinking it was really important to wearing the mask on the streets, but unlikely UK people, they are not really aware of that fact. What if there are people out there who really need one but can't get hold of it, like me? So it was quite a natural step for me to start thinking about what I could do using my skills as a fashion designer. So I went for the obvious choice as a fashion designer to make masks out of dead stock fabric and provide them to the most vulnerable. That's how this project started. Normally I can make 20 to 30 woven masks per day, non-stop making, then I can cover 20 to 30, but it wasn't enough to cover all the essential workers around me or the hospital workers. So we decided to put the mass production, but we have to think about how we can cover the cost of the manufacturing. So, and plus, so many people are contacting me, can we buy one, can we buy one? And we thought maybe this is a really good idea. We can sell to the public and get some fund from them by selling the masks. Then we can put that money into the mass productions. When I started the mask donation to my neighbors, especially elderly people, I had to put the mask into their mailboxes rather than meet them in person to give them away. And one day I opened my postal box and I found some cashes there with little warming message say thank you. And some people they leave some cashes in my mailbox, and supermarket workers, they come to pick it up and they give some donuts and chocolates and some sandwiches and foods for thanks. That moment is really make me warm. People has the humanity here and they care each other. They understand what we do and they appreciate what we're doing, which makes me to keep doing it. Okay, so this is the finished mask. I know you guys asked how long I'm gonna keep doing this project. Well, obviously, when this outbreak's getting slowed down, and until I definitely wanna do this one until the people change their mind and they're thinking differently about wearing the masks. And when the coronavirus finished, then I definitely don't have to do this one again. I wish I don't want to I wish I don't have to do this one again.
It's about 2:20 in the afternoon here in Seoul, and we are poised to join the Central Disaster and Safety Countermeasure Headquarters for its regular briefing on the COVID situation in this part of the world. Now, as we mentioned earlier, the most recent cases of COVID-19 here in Korea are imported infections, and thus health authorities are poised to transition their social distancing campaign into a daily life quarantine initiative from Wednesday that will see the resumption of schools and certain businesses, albeit in a gradual manner. Local cases of the virus have been hovering in the teens, single digits, and on some days like today, no such contagion has been found. Meanwhile, as of early Monday, Korea's total infections, we saw it rise by 8 cases, all imported, raising our total to 10,801. Here now is a briefing. We'll come back to you after it.
Here is Director Chung Eun-kyung with the briefing. Let us now begin our regular briefing on the coronavirus outbreak here in South Korea. As of May 4th, Monday, the total number of confirmed cases stands at 10,801. This includes 1,099 imported cases from overseas. And of the total, 85.3% or 9,217 have been discharged. And currently we have a total of 1,332 people in quarantine undergoing treatment. Yesterday we had 8 new cases. And yesterday, unfortunately, we had 2 more fatalities. And I extend my deepest condolences to the deceased and the members of the bereaved family. Today, the 8 new cases were all imported cases, and there were 0 cases reported as local infections. And among the countries, America accounted for 3 of the imported cases, and the other 5 were from UAE, Kazakhstan, and Kuwait. And looking at the sources of infection for the past 2 weeks, we had a higher rate of infection from imported countries, accounting for over 72%, and also 1 which were related to the imported cases, and 7.9% were related to nursing hospitals, and it decreased by a bit, and also 4.4% was related to community infection. And currently we are doing the investigations behind 8 cases, which account for about 6.3% of the total. And looking at the trends of the outbreak, today the KCDC held a meeting presided over by Prime Minister Chung Se-kyun, and we decided to transition into everyday life quarantine starting from May 6th. We believe that COVID-19 cannot be terminated in a short distance of time, and we predict that we will have a prolonged outbreak. And to this end, we urge the public to have a responsibility and take a responsibility to keep your guidelines, the 5 major guidelines for quarantine. And we also advise you to be disciplined with the face mask guidance and the quarantine measures. And we also advise you to be disciplined with the healthy everyday lifestyle, as well as those for the chronic illnesses as well. And as for these quarantines, we also open our ears for the opinions of the public, and they also reflected these opinions as well. And as the masks are effective in the curbing the infections through droplets, we also highlighted the importance of wearing them at public transportations and indoor public facilities, as well as outdoor places if there are crowded and it's difficult to have a 2-meter distance with each other. And social distancing in daily lives, the transition into these measures is very crucial to maintain our everyday life while we carry out disinfection measures. And this does not mean that we will be immediately going back to our pre-COVID-19 days. However, we will be making a new norm in terms of disinfection and quarantine. So we are walking towards a new way of life. And if the conditions of COVID-19 aggravates in the near future, we will return back to intensify social distancing measures. And these measures will be put in place with the cooperation by the public, the government, and the society. The government, as mentioned in the earlier briefing, we had the KCDC meeting presided over by Prime Minister Chung Se-kyun. We analyzed the situation, and starting from May 6th, we will be transitioning into our everyday life quarantine measures. And these were possible thanks to the participation of the members of the public for taking part in the quarantine measures, as well as the medical staff members who have been exerting full efforts to diagnose and to treat the patients. And we were successfully able to curb the outbreak to a certain extent. However, still we don't have an effective vaccine or therapeutics against the virus. Therefore, it is difficult for us to terminate the disease at an early state. And we also see a global pandemic which is lingering in Africa and in Latin America as well. And even here in South Korea, there are some cases, sporadic cases, in fact, that are related to these unidentified sources of infection. However, thanks to the social distancing measures, we were able to prevent another big widespread cluster infection. The aim of the KCDC is to, before we have an effective vaccine and therapeutics, we aim to have a control over the COVID-19 virus so that we do not have too much of a burden on our society as well as our healthcare system. And to this end, we believe contact tracing, screening, testing, diagnosis is very important. We need to make these more effective and more professional. And the medical experts, we need to increase their capability for treating this virus. And we also need to expand our capacity for the healthcare system to treat these patients. And furthermore, it is very important for the public to have a disciplined manner for quarantine against COVID-19. And this is very important because we cannot go back to the pre-COVID-19 days any earlier. The quarantine authorities believe that we need to monitor the situations here in South Korea, and we will also be monitoring the global outbreak, and we will see whether the situations are being severe or grave, and we will adjust our responses. Thank you very much.
Right, that was the government's afternoon briefing on the COVID-19 situation here in Korea, and I have our Kwon So-ah still in the studio to give us a summary of the key announcements.
All right. Well, all 8 cases reported as of 12 a.m. Monday are imported cases. And with that, Jung Eun-kyung, the chief of the KCDC, noted when it comes to the sources of infections in the past 2 weeks, more than 70% are attributed to overseas cases. And just like other officials, like the Prime Minister mentioned earlier, Jung said how we will transition into everyday quarantine measures beginning May 6th. And what that means is that social distancing measures for individuals will remain pretty similar, but public facilities and businesses will have some relaxed measures beginning that date.
Right, so thank you very much for that. We'll see you again on Wednesday.
All right.
우리의 방역 모델에 대해 전 세계가 관심을 갖고 주목하고 있습니다. 이른바 K-방역입니다.
Korea's strategic containment efforts of COVID-19 have secured a global recognition, and in today's studio discussion, we delve into K-quarantine, which is being hailed as a global gold standard. I have Professor Chung Sun-jae from Yonsei University College of Medicine. Welcome, Professor Chung.
Thank you for having me.
And I have Frank Smith, a correspondent for Deutsche Welle. Good to see you again, Frank.
Good to be back, thanks.
Professor Chung, K-quarantine refers to the entire process of Korea's, that is, COVID-19 countermeasures ranging from testing, tracing to containing. Which of these efforts do you believe is the most important component of K-quarantine?
Yes, as you said, the K-quarantine model itself is just to share our various best practices against COVID-19 outbreak with the international community so that the world can overcome the coronavirus more effectively. And among testing, tracing, and containment of K-quarantine, the most popular things may be from the test period, that is that drive-through and walk-through test centers, and also from the containment, the triage care center operation models are the benchmarked by many countries around the world. And also in the same time, the same testing step, the real-time RT-PCR, which is the COVID-19 diagnostic technique, is ahead of the establishment of the international standard in November of this year. So the standard proposal for the Korean Triage Care Center format has already been submitted to ISO, which is the International Standardization Organization. So they are all kind of very important processes in there. And I have to say the K-quarantine method is a very important thing too.
Right. We'll talk more about the certification process later on. Frank, which aspect of Korea's COVID-19 response has caught the attention of the international community, in your opinion?
Well, for me, it's that trifecta that was mentioned earlier by the doctor here, testing, contact tracing, and quarantining. For me in particular, I look at the contact tracing and the way that the government has used data from people's phones, their locations, to notify people if they were in this vicinity of people that had proven to be infected, and contacting those people and having them tested. That way, when somebody was found out to have the coronavirus, that case wasn't spread indiscriminately throughout the population, and any sort of outbreaks were somewhat limited.
Professor Chung, walk us through the secret, perhaps, of Korea's success in setting up an effective quarantine system that is 5 years after the MERS outbreak.
Yes, I think the background of this successful disease control has been decisively influenced by the mass inspection and early diagnosis of the confirmed patients. But I think it's not all. As you said, that I think the effective control of COVID-19 outbreak in Korea can be explained by the MERS outbreak in the past, which swept Korea in 2015. Korea has been conducting and evaluating mock drills on a national basis for preparing for the influx of new infectious diseases and bioterrorism for several years ago. So through this, the standard manuals and the guideline for infectious disease and risk management protocols were supplemented, and also the immigration quarantine programs and inpatient bed management and the immediate response team dispatch was also checked annually. So without this effort, I wouldn't say this kind of success would exist today. And thanks to this COVID-19 situation, all the programs in immigration, quarantine, patient classification, and treatment could be done very quickly.
Professor Chung, what factors enable Korea's high capacity and volume of testing for COVID-19? I understand we can have 17 tests. Is it 17,000 tests a day?
Yes, so I would like to say about two things, and the number one is the emergency use of approval system from the government. So this system enabled rapid dissemination of diagnostic kits, and this system is that it permits the manufacture, sale, and the use of diagnostic products that have not yet been approved by Korean FDA for a limited time. So, and this was introduced after MERS outbreak, actually. So there were like 4 companies producing about 17K products, which were analyzed 24 hours every day. And with this flexibility, if there is an additional need, then the supply would be increased at 3 times as the current amount. So I think this flexibility is still number one. And for number 2, free tests for the suspected cases, I think that's the one. because if anyone had proper symptoms or history, then all fee for the test was waived. And even though if you are not in that case, like if you don't have that kind of history or the symptoms, but if you still want to be treated or you still want to be tested, then you only have to pay about 160K won, which is relatively cheap than another country. So this test was conducted by screening clinics located about 607 centers nationwide. And to enable this, the Korean government investigates a huge amount of budget, like 2.9 billion won for the prosecution.
I see. Frank, many countries have adopted Korea's drive-through and walk-through testing centers. What is the response to those centers so far?
Well, they've been pretty positive. Here in South Korea, myself and I know other journalists did several reports about South Korea's drive-through testing and also the booth testing that a hospital and a doctor here developed. In fact, I was asked by a doctor in San Francisco to put them in touch with the doctor that developed the booth for the booth testing. And there are other methodologies that are used, but certainly other countries around the world have benchmarked South Korea's testing strategy and testing infrastructure in order to get that out to its population. One of the problems that they've had, though, is that there have been testing so-called deserts, where people in certain communities, in certain regions, in some countries like the US and in Europe, haven't been able to get the tests. And that plays to another important part, and that's the governance of this. In South Korea, you've had a very strong, what South Koreans call control tower from the top, the federal government, the national government, controlling the response to the coronavirus. And that has been a little bit missing in other places.
I see. Before we continue, perhaps no other place best exemplifies the effectiveness of K-quarantine than Incheon International Airport, the gateway into the country, that has yet to report a single case of infection among its workforce of more than 70,000. We have more in this report.
Incheon International Airport, South Korea's main gateway and air passenger hub, is standing guard as the country's first line of defense against the possible influx of COVID-19. In the 100 days that have passed since the first case of COVID-19 was reported in South Korea, more than 3.4 million people have entered the country and the number of imported cases has also been on the rise. Remarkably, not a single employee at the airport has been infected with the coronavirus thus far. With some 70,000 employees working around the clock at the airport, how did they manage to stay infection-free?
상주 직원들은 마스크를 쓰고 사회적 거리두기라든지 기본적인 그런 안전 수칙을 저희가 지키고 있습니다. 사무실이라든지 또 작업장 들어갈 때도 미리 다 발열 체크가 돼서 이상이 없는 사람만 지금 안에 작업장에 들어갈 수 있도록 그렇게 조치를 하고 있습니다. 도착 승객들은 입국 검역을 받게 됩니다. 유럽이나 특히 미국에서 오는 승객들은 전원 코로나 바이러스 검사를 받게 되고요. 출국하는 경우에는 약 3단계에 걸쳐서 발열 체크를 하게 되고 공항에 도착했을 때 또 출국장 들어갈 때 한 번 더 하고 탑승하기 직전에 그때도 발열 체크를 지금 하고 있습니다.
Some 1,200 cleaning staff at the airport were assigned to help out with the quarantine efforts.
일일 분무 소독을 일일 3회 하고 있고 그다음에 위생 소독도 일일 3회 하고 있습니다. 그리고 선별 진료소라고 마련되어 있는데 그 지역도 일일 3회랑 하고 있고 무슨 일이 일어나면 그 일어난 자리 그러한 지역은 특별히 한 번 더 추가적으로 방역을 하고 위생 소독을 하고 이렇게 이루어지고 있습니다. 처음에는 무섭기도 했지만 공항 직원들이 국경을 지킨다는 그런 자부심으로 일하고 있습니다.
Efforts and precautions taken by airport workers, coupled with high-tech quarantine procedures, helped the air hub achieve the extraordinary feat of reporting zero infections. However, it is not time to relax just yet. The airport is preparing itself for a long, protracted battle against the pandemic, necessitating follow-up measures to respond to the evolving threat of COVID-19.
근데 이제 앞으로는 이런 첨단 기술을 더 활용해서 특히 정보와 ICT 기술을 활용해서 입국 단계부터 그 이후의 모든 검사 상황 그것까지 철저하게 모니터링을 하고 또 출국할 때도 마찬가지로 철저한 방역과 같이 연계된 그러한 그 첨단 기술을 적극 활용할 계획입니다.
For now, South Korea remains safe and protected from the pandemic thanks to these everyday heroes fighting against COVID-19 on the front line.
Right, Professor Jung, what are your thoughts on the screening measures adopted by officials at Incheon International Airport?
Well, it was very interesting. And actually, the International Airport is basically run by 24-hour response team, as I heard, and which is known to cooperate with the Korean KCDC and the Ministry of Land, Infrastructure and Transport. So in particular, I was impressed that there were 3-stage fever check, so at each entrance. And the more intensive steps provided, such as self-diagnosis mobile application, and also the walk-through booth for the COVID-19 testing. And I think the previous quarantine system, which mostly relied upon self-report and thermal camera only, has been largely strengthened by the response against COVID-19 outbreak.
I see. Frank, how are these screening measures at Incheon International Airport different from those at other airports worldwide?
Well, I think a couple of things are different. One is that when people come in, they have to go into a 14-day quarantine. Other countries have adopted similar methods, but in South Korea, you got to pay for it yourself. I think that's reasonable for a traveler to have to pay for their own quarantine if they want to come here. Also, there's an app that they place on the person's phone so that if they go out into the community when they're under quarantine, authorities will find out and be able to prevent the spread of the coronavirus from those imported cases, which now are making up the majority here.
Right. Professor Chung, I believe Korea, like you mentioned earlier, is seeking to secure international certification for K-quarantine. Now, this includes its drive-through centers, the testing centers, and also for its triage care centers. What meaning would such recognition have for Korea, in your opinion?
So as I'm an epidemiologist and as a public health professional, I think this is the way that the Korea's international status is enhanced. Well, because before also Korea has a top level fields such as IT, manufacture, or cosmetics, but also I think the public health and infectious disease control has been now leading country for Korea. So it's very good thing. And also, as you said, that we have very creative and effective models such as drive-through, walk-through, or the patient screening clinics, and the operation model for triage care center. So it also shows our strong creativity to the threat.
Right. Frank, aside from what we've dealt with, what are some of the other factors that may have played a part in Korea's success story against COVID-19?
Well, we all have heaped quite a bit of praise on the government and the medical community's measures and strategies in implementing coronavirus sort of methods to prevent the spread of the contagion. But I think it comes down to the South Korean people trusting the government and being informed and buying into the measures that they need to take when they go out to the supermarket or where they have to go to purchase things. People are wearing masks, they're disinfecting their hands, and they're preventing the spread of the virus through their behaviors and their trust in the government and the measures that the government is undertaking here.
Right, so it's like a three-part work. You have the public, the medical experts, and the government.
Sure.
Professor Chung, I have one final question. There are concerns of a possible second infection. What are some of the efforts that we could make to ensure that such an infection would not be as severe?
Yes, actually, in fact, the epidemic of the infectious disease can only be assured when there is the proper treatment or proper vaccine. And also, like US CDC said that their aim is to develop the novel vaccine by the next January, which means that we still have a long time to stand without proper treatment. So without vaccine or treatment, in the public health point of view, life prevention methods such as hand washing or keeping physical distance are the things we can do with priority. So in addition, we have experienced a lot of psychological stress and trauma after the first corona outbreak, and it is known that this psychological state may worsen after this kind of group trauma. So therefore, it is necessary to pay attention to keep regular healthy lifestyles and also the healthy mindset, along with the focusing on proper life prevention methods.
I see. All right, Professor Chung, thank you very much for your thoughts. And
Thank
Frank,
you.
as always, thank you for being here.
Good to be here. Thanks.
And that brings us to the end of Monday's edition of COVID-19. We'll be back on Wednesday. That is the day after tomorrow, which is a public holiday here to mark Children's Day. If you're planning to head outdoors with your family, do practice personal hygiene, do wear a face mask, and do refrain from venturing into crowded indoor spaces. Also, do reach out to us through our social media accounts or our homepage, arirang.com. Thank you for watching.